Today, our group is going to present about the drugs that can be used to treat GERD and dyspepsia. Mainly, there are three groups of drugs that can be used to treat GERD and dyspepsia, which is antacid, H2 blocker, and proton pump inhibitor. Melanta is a type of antacids used to treat GERD. The generic name of Melanta is aluminium magnesium hydroxide, calcium carbonate magnesium hydroxide, and calcium and magnesium carbonate. The uses and indication for Melanta is it is used to treat the symptoms of too much stomach acid such as GERD, stomach upset, heartburn, acid indigestion, gastritis, hiatal hernia, and peptic ulcer. There are three types of Melanta which you can see here. The clinical effects of Melanta is aluminium and magnesium in antacids work quickly to lower the acid in the stomach. This medication works only on existing acid in the stomach and does not prevent acid production. Many people using this medication do not have serious side effects, but still it can occur like nausea, constipation, diarrhea, stomach pain, and many more. There are some precautions for people who want to use Melanta, like for people who have allergic, frequent alcohol use, dehydration, kidney problems, pregnancy mother, and breastfeeding mother.
Next, I will explain about drug for dyspepsia, which is antacid. The drug that I choose is Alka-Seltzer antacid capsule. The generic name is calcium carbonate. The use of this drug is to treat symptoms caused by too much stomach acid. The clinical effect of this drug is work by lowering the amount of acid in the stomach. The common side effect of this drug is constipation. Other than that, loss of appetite, nausea or vomiting, headache. Moreover, there are rare but very serious side effects occur, which is sign of kidney problems. The most important is calcium carbonate can decrease the absorption of other drugs, including tetracycline antibiotic, iron, levothyroxine, and others. The precaution of this drug is the patient allergic to calcium carbonate, allergic to inactive ingredients such as milk or dairy product, patient that has health problems such as hypercalcemia and kidney disease, the patient that has phenylketonuria or any other condition that require you to restrict the intake of aspartame.
Antacids are divided into systemic and non-systemic antacid. For systemic antacid, sodium bicarbonate will react with the hydrochloric acid and form water and carbon dioxide. The carbon dioxide will cause a gastric distension and provoke gastro-esophageal reflux that will stimulate the secretion enhancement. In person with the normal renal function, excess bicarbonate ion will be excreted into the urine or feces, but in abnormal renal function, the excess bicarbonate ion will accumulate and cause the systemic alkalosis. For non-systemic antacid, calcium carbonate will increase the pH and inhibit the activity of the pepsin, and it will also increase the prostaglandin and bicarbonate ion to form a cytoprotective effect. Calcium carbonate will neutralize with the hydrochloric acid and form insoluble salt that will be excreted.
Now I'm going to talk about H2 receptor blocker drug for dyspepsia, which is acid. Acid is a type of H2 receptor antagonist that will reduce the amount of acid in our stomach. It can treat endoscopically diagnosed esophagitis and can also treat associated heartburn due to GERD. Acid is a competitive and reversible inhibitor at the H2 receptor in our gastroparietal cells. It can cause anti-secretory activity and also gastrointestinal secretions like the pepsin, intrinsic factor, and also serum gastrin concentration. The side effects for acid are sweating, sleepiness, skin rash, yelling of the eyes, and many more. The precautions are those who have possibility of malignancy should be excluded prior to the therapy, as the drug will mimic the symptoms, and those who are increased risk in community-acquired pneumonia and those who have renal impairment should be avoided.
Talk about H2 receptor blocker for GERD, and this is an example for the drugs. And all of these drugs will undergo the first pass hepatic metabolism, and all of these drugs will be cleared by the hepatic metabolism, glomerular filtration, and also renal tubular secretion. As is an example, cimetidine. The uses of the drugs, of course, for GERD and also for the non-ulcer dyspepsia, and also can be used for the prevention of bleeding from the stress-related gastritis. And the clinical effects of the drugs can exhibit the competitive inhibition at the parietal histamine receptor, and also they can suppress the basal and mean-stimulated acid secretion that can lead to the reduction of the volume of gastric secretion and also concentration of pepsin. Generally, the side effects of the drugs, it can lead to the diarrhea, headache, fatigue, and so on. But specifically for cimetidine, it can disturb the regulation of the sex hormone in our body, and the long-term or high doses uses for these drugs can lead to the impotence in men and galactorrhea. And of course, the precaution is for pregnant women, elderly, and patients with renal and hepatic disease.
Today I will be explaining about H2 blockers. So this is the difference between a normal stomach and a stomach with GERD. So on the stomach lining, when histamine binds to H2 receptor, it will stimulate the secretion of stomach acid, which is a hydrochloric acid, and the backflow of it result in GERD. So to treat this, we can use H2 blockers because H2 blockers can compete with histamine to bind at H2 receptors. So the binding of H2 blockers at H2 receptor would inhibit the secretion of gastric acid. So the overall pharmacological effects of H2 blockers are such as inhibiting secretion of gastric acid, decreasing pepsin secretion, treating peptic ulcers, and the H2 blockers which are often found in markets are such as famotidine and cimetidine.
Okay, so hi, Assalamualaikum. I will talk about proton pump inhibitor drug, which is omeprazole, the most common one. It is an oral type medication that is used to cure symptoms of upset stomach, heartburn, and also acid digestion. The clinical effect is to increase the pH of stomach by decrease the production of gastric acid. Therefore, it reduces the reflux of acid into esophagus that can cause heartburn. They work by blocking H plus K plus ATPase enzyme that are responsible for production of acid. The side effect can be seen through these three, which are vitamin B12 deficiency, the fracture risk, and also risk of infection. Low level of HCl in stomach will reduce the absorption of vitamin B12 and also have downstream effect that reduce the absorption of calcium, and this result in osteoporosis. Infections such as pneumonia, Campylobacter, and Clostridium difficile infection also can occur. The precaution, it contains ingredient that can cause allergic reaction. The patient with bloody stool need to reduce the dosage as it increase the risk of diarrhea. It is not suitable for breastfeeding mother, and patients with high level of magnesium in the body need to avoid from taking this drug. That's all from me. Thank you.
I will move on to another drugs, which is Acifex or rabeprazole. Acifex is used to treat stomach ulcer, GERD, zoonoses syndromes, and sometimes dyspepsia. Acifex is also to treat Helicobacter pylori eradication in combination with other antibiotics. The clinical effects of Acifex is used to decrease the acid production in the stomach by inhibiting the enzyme responsible for the acid production. The common side effects of Acifex are rash, upset stomach, diarrhea, headache, insomnia, or nervousness. The precautions of Acifex are it may increase risk of bone fracture, especially in patients who consume the drugs with higher doses or for a long time. Next, patients who have allergic towards the drug or similar drugs should tell the doctor before consume the drugs, as the ingredients may cause the allergic reactions. Lastly, pregnant patients should consume the drugs when clearly needed.
I will explain about the proton pump inhibitors. Known as a PPI can block a gastric hydrogen potassium ATPase to inhibit gastric secretion. How it inhibits is by activated PPI will be converted into the sulfonamide in parietal cells. So sulfonamide will interact with the sulfonyl hydryl group, which can inhibit the gastric acid productions. For example of the PPIs are omeprazole and pantoprazole. And basically, besides GERD, PPI also can treat dyspepsia and peptic ulcer disease. Thank you.